Kia ora folks, welcome to the FWW Podcast. My name's Tommy, and I'm doing my best to help. That was nice and fast, eh? Hey, I was having a client, hey, I'm in a new location. What's happening here? What's going on? Well, here's what's going on. This is an office where I work sometimes, and I'm just using this space. I brought my camera with me and my little light, and we'll see if this works all right. Hey, I was with a client yesterday, and they told me that they were worried they had borderline personality disorder. And I was like, hey, I don't think you've got borderline personality disorder. Here's my thing with diagnoses, right? I'm not going to say I think the whole way of diagnosing mental health conditions is fucked here in the West. I'm not going to say that. It might be the case that's true, but that's not what I'm saying. That's not my position. I would say the diagnostical and statistical manual for mental health disorders, what we call the DSM, the DSM-5, and used to be the DSM-4, DSM-3, etc. I'd say it's problematic. I'd say it's very fucking problematic, okay? And I'd say that it's the world standard for diagnosing mental disorders, and until quite recently it had homosexuality in there. So we're talking about a methodology for assessing people's mental health that pathologizes, normal human things, you know what I mean? There's some crazy statistic about the number of people in the world who hear voices, and yet, according to the DSM, right, that would be almost guaranteed fucking psychosis, you know what I mean? So it's really... Its lens, its cultural lens is so fucking Western, is so Eurocentric. It's undeniably problematic. But it's not like we can throw the baby out with the bathwater. We can't just say everyone who fucking has mental health just needs to fucking meditate more, just fucking have a positive attitude. You don't really have schizophrenia. You just need to take ayahuasca. It's not that fucking simple, right? It's nuanced. So my clients say to me, I think I meet the criteria for fucking borderline personality disorder, or I think I'm on the spectrum, or I think I've got ADHD or whatever. It's not about what I fucking think. It's about how that affects them. Like, what does that mean to them? And would they find it useful to think that they have ADHD? Would they find it useful to think that they have, narcissistic traits? Like, you are what you are. You are what you are, and if there's some little box that you feel like you fit in, and being in that box makes you feel more like it makes sense, and then there's solutions that work for people in that box, and now you can try the solutions that fit for the people in that box because you think you're in the box and the solutions work. Well, all of that's merry and happy and perfect, right? That's a great situation. What I worry about sometimes is that people will think, okay, now I'm in this box, now I'm in the borderline personality box, or now I'm in the autistic box or the ADHD box, and therefore these solutions should work for me. And now they try the solutions and they don't work for them, and they go, well, now I'm even more fucked because I've worked out what's wrong with me, and the solutions for people who have that problem don't work for me. This thing I'm leaning against is rattling, so I'm going to move forward, but I'm going to need to move this table that this camera's on backwards. Oh, and the light nearly fell over. Okay, here we go. We're still good? Okay, I've got my hair out for this one. You've never seen that before. Or maybe one other episode, and then I looked at it and I was like, that is terrible. Don't ever wear your hair out again. But this time I've got it to one side. So now I'm like, on this side I got long hair, on this side, not so much. Anyway, but this client of mine, they start telling me a very, very fucking compelling story for why they think they've got borderline personality disorder. Oh, my light did fall over. But here's the funny thing, folks. As they're telling me the reasons they think they got borderline personality disorder, I'm just going, fuck, I'm like that. I'm like that. I've got that. So I didn't have a actual topic for today. I thought it'd be just funny. I'm going to look up the criteria for borderline personality disorder, and I'm going to go through them with you and tell you how many of them I think I have. And at the end, I'm probably going to say to you guys, I'm pretty sure I got borderline personality disorder. So let's find out. And why I think this is a useful thing to do is because, and the DSM-5 criteria for borderline personality disorder, why I think this is a useful thing to do is because I don't probably think I really do have borderline personality disorder. I might have a lot of the traits, but why I think it'll be useful, here's why. Is because it might show, at least I just say I don't have any of them, in which case it'll be boring, I might not air the episode. But I just think, like when I was fucking studying psychotherapy and I had to go through all the main different psychological conditions and stuff like that, I always thought I had all of them. Like, when you start looking at the fucking criteria, you start looking at Dr. Google, it's like, it's amazing what fucking disorders and shit you'll have. So here we go. Why can't I make that look bigger? DSM-5 criteria. Okay, cool. Frantic efforts to avoid real or imagined abandonment. Frantic efforts to avoid real or imagined abandonment. So I had real abandonment as a child, and I have some fear of abandonment. No. When I'm in a romantic relationship and it ends, it brings up a historic trauma, and I don't try and frantically avoid the relationship ending. No, okay, I don't meet number one. 2, a pattern of unstable and intense interpersonal relationships characterized by alternating between extremes or idealization and devaluation. Unstable and intense interpersonal relationships. No, I have not had any. I've had very few, if any, unstable interpersonal relationships. Though I've had lots of intense ones, and they were quite nice. But they were intense in a pleasant way, where intensity was something both parties wanted. So I don't really meet that one either. Okay, this episode's not turning out how I thought. It's not as easy to diagnose yourself. But here's the thing. I'm looking at this with a clinician's eye. So you might be able to read these criteria and go, oh, fuck. Also, the things this person was saying to me about why they thought they met criteria, those criteria haven't been met yet. So maybe I'll find one on here that I do meet. 3. Identity disturbance, markedly and persistently unstable self-image or sense of self. Okay, this is one maybe I meet. When I first so I'd had a bunch of counseling, I guess, as a kid before I got clean. And once I got clean, I was kind of mainly did all my personal work in a 12-step fellowship. I didn't really get personal counseling after that. But then I trained to become an addictions counselor. And after I was an addictions counselor, I did some post-grad training in psychotherapy. And during that period of time, I saw 2 or 3 different counselors in different blocks. And one of them, the one who was the most kind of academically intelligent, said to me at the end of our first session, she goes, well, I think I think I can tell what your main problem is. You don't have any sense of self. And I was only like 25 at the time. And I was like, fucking lead singer of a band, like living my best life, had, always had beautiful relationships, with my, a lot of great friendships, was a influential, supportive, loving character in my communities. In the 12-step fellowship, I was a mentor. In the musical community I was a part of, I was respected as someone with integrity and honesty and someone who's generous and caring. And she goes, you don't have any sense of self. And I was like, I was like, yeah, that sounds about right. That feels all right. And we just looked at each other and laughed. I was content with it. I didn't feel offended by it. To be honest with you, I've always had this issue with people who I can describe as like, there's a certain personality type, and it's called like the self-made man. I struggle with the self-made man. I struggle with the person who is constantly confident and constantly knows what they think about everything. I can be passionate, but I've always tried to hold even back then, even in my 20s and teens, I've tried to hold my beliefs pretty lightly. I don't really know who I am. I don't really know what I'm about. Like, I stand for some shit, right? Like, I'm against racism, I'm against sexism, I'm against homophobia, I'm against cruelty. Like, I believe in generosity, I believe in kindness, I believe in love. Things like that. But that's pretty high level, right? Like, when it comes down to the minutiae of policy or stuff, like, do I think I know the best way to legislate a fair and just society? Like, fuck no. You got to ask a political scientist that shit. So when she said you don't have any sense of self, I wasn't really offended by it. I was like, well, I am who I am, right? Like, I'm this guy, and I like being this guy, and I'm a nice guy, and I'm doing well for myself. And yeah, sounds like this really highly trained psychotherapist thinks I don't have a sense of self. I guess I don't need one. I was kind of cool with it. Okay, identity disturbance, markedly and persistently unstable self-image or sense of self. Oh, but see, mine wasn't unstable. I was cool with it. And I don't think it was unstable. I think I was consistently didn't have a sense of self. 4, impulsivity in at least 2 areas that are potentially self-damaging. Spending, sex, substance abuse, reckless driving, binge eating. No, I don't have any of those. 5, recurrent suicidal behavior. Gestures or threats of self-mutilating behavior. No, I don't have any of those. Affective instability. Affective instability. Instability that is effective. Or affective. I read the word wrong. It's not effective. It's affective, guys. Affect and effect are real different. I'm not a good dictionary definition kind of guy. You have to look up the difference. But affect is, effect is like the effect of something. Or you're not allowed to use the definition. You're not allowed to use the word in a definition. The effect of something. The result of something. Affect is like, how would you describe it? Like an aspect of character. I don't know. You got to look up the dictionary. One spelled with an E, one spelled with an A. Affect instability due to a marked reactivity of mood, intense episodic dysphoria, irritability, anxiety. No. I don't have any of that shit. Chronic feelings of emptiness. Yes. Chronic feelings of emptiness. I've got that one. But not in a way that I'm uncomfortable with. I've made friends with this. I'll tell you what, probably most of my adult life, I didn't have chronic feelings of emptiness. Most of my adult life, I had subtle fears of emptiness. And in the last few months, I have embraced emptiness. Oh, I haven't done a podcast about that. One of my last lessons before I started sleeping again, or just after I started sleeping again, was all about emptiness. And now I have this beautiful relationship with emptiness. I used to think, I know this is a weird thing to say. Oh, fuck, maybe I have done one about this. Sorry if I'm repeating myself. I literally used to think of empty, right? I thought empty was just a synonym for like loneliness. I thought emptiness meant like the most intense form of loneliness. I never even thought about what it actually meant. Like just space, like an empty space, like an empty vessel, right? Is a vessel that is pure space. It's like the absence of stuff. Emptiness, space. And like I said on that other podcast about, space is loneliness, it's like, no, space is actually creativity. Emptiness is now this, like, I'm like, fucking emptiness, come take my hand. Like in my meditations, in my walks, I have a new, not just respect or a lack of fear, like I love emptiness now. So I wish I would have chronic feelings of emptiness, because that'd be fucking awesome. My mind's too fucking busy. I wish I had more emptiness up in this motherfucker. But I don't have chronic feelings of emptiness. I've had subtle feelings of emptiness and that I was afraid of. And I've been running from them my whole life, and now I'm not. Now I fucking love that shit. Inappropriate, intense anger or difficulty controlling anger. No, I've never had that. Transient, stress-related, paranoid ideation or severe dissociative symptoms. No, I don't have any of that. Well, here's the fucking thing. My client told me all the reasons why she thought she had borderline personality disorder, and I was fucking so compelled by her narrative. I was like, fuck. I didn't say it to them, but I was like, maybe they do. Maybe they do have fucking borderline personality disorder, but if they do, I've got it too. But the things they were saying about what borderline personality disorder is were none of those fucking 9 criteria that I just read out. So you got to be careful, folks. You might think you have fucking narcissistic personality disorder. You might think you have histrionic personality disorder. You might think you're a drug addict. You might think you have ADHD. You might think you have fucking be on the autism spectrum. And it might just be that you've seen too many fucking memes on Instagram or TikTok or whatever. You got to look up the shit, man, and find out what the actual criteria are. Don't take fucking Ritalin, man. You don't know if you've even got it. I mean, obviously, if you've been prescribed by a doctor some Ritalin, you probably do have it. It's more I'm saying don't try your friend's Ritalin. You know what I'm fucking talking about. This is how people think they can. This is what people are doing these days to find out if they've got fucking ADHD. They take their friend's Ritalin, and if they don't get all speedy from it, like if they just have a nice time and feel like they can concentrate and have kind of a good vibe from it, they're like, shit, this Ritalin doesn't do to me what it does to other people. I must fucking have ADHD. That's all it takes. Now I've got ADHD. That's not proof, man. That's not evidence. That's just you like how fucking Ritalin feels. Don't convince yourself you've got ADHD because when you took your friend's Ritalin, you didn't get all speedy. Instead, you felt quite calm and confident and grounded and concentrating. Fucking stimulants do all different types of things to all different types of people. It's a very normal. It's the way Ritalin affects people with ADHD. Some people who don't have ADHD get affected that way by stimulants too. In fact, a lot of fucking people do. That's why people love stimulants, right? You ever heard of a thing called cocaine? People love that shit. Now, some people take cocaine and they get all speedy and chatty and shit. Some people just take cocaine and chill the fuck out. And not all of those people have ADHD. Okay, so I've done that. That was an epic fail. I don't even know if this is interesting. What's something else I can look up to see if I've got? I'll fucking look up ADHD criteria. Let's see if I've got ADHD. Everyone tells me I do. I'm like, motherfucker, just because you can't keep up. ADHD criteria, DSM-5. We're on a roll. Yes. Okay. What are the criteria for ADHD diagnosis? Your child must have 6 or more symptoms. Okay. Just give me the fucking list, man. Jesus. Even just looking for the fucking criteria for ADHD, I feel like I've got it. Now they're saying there's 5 levels of ADHD. DSM-5 diagnostic. Okay, come on, man. No, I don't want to download a file. Okay, well, I had to download a file. Here we go. I don't know if I've got attention deficit hyperactive disorder, but impatient motherfucker disorder, I've definitely got impatient motherfucker disorder. Now it's opening it on Kindle. I didn't even know I had a Kindle app on my phone. Are you fucking serious with me right now? Just let me see the fucking criteria. This is outrageous. People shouldn't have to wait this long, eh? You know, this person said the coolest thing to me. They said, when we were kids, right? They said, when we were kids, we wanted to see a movie. When we were kids. If we wanted to see a film, we would have to wait. We would have to wait until it came out on video. And then we would go down to the video shop. We'd walk for an hour to the video shop. And then if the film had, it had already been taken out, like they've got 5 copies because it's a new release, but they'd all been taken out, we'd have to come back next Friday when we got our pocket money next week to get out that movie. Nowadays, if a kid wants to see a movie, they literally download it within, like 2 minutes on their phone and they can see the movie, the brand new movie. And it's like they were saying the wait time between wanting something and getting it it's become obscene. And they were saying they might even been saying that might cause ADHD. And here we go, we've got the criteria for you. Symptoms and or behaviors that have persisted for over 6 months in 2 or more settings. Symptoms have negatively impacted academic, social, and or occupational function in patients aged under 17 years. Okay. Displays poor listening skills. So I'm gonna answer these questions as if I'm 16. Displays poor listening skills. Yes. Loses and or misplaces items needed to complete. In fact, I'm going to do it like I'm an adult right now. In fact, I'll do it for both. Displays poor listening skills. As a kid, yes. Now, no. Loses and or misplaces items needed to complete activities or tasks. As a kid, yes. Now, yes. Sidetracked by external or unimportant stimuli. As a kid, yes. Now, not really. Forgets daily activities. As a kid, yes. Now, yes. Diminished attention span. Diminished compared to fucking what? No, I don't have that now. As a kid, I had it, but was that ADHD? Or was that the fact that I was smoking weed 4 times a day? It's hard to say sometimes. Lacks ability to complete schoolwork and other assignments or to follow instructions. As a kid, yes. Now, as an adult now, I don't fucking like doing boring shit. I don't like doing my paperwork. I will procrastinate a bit crazily around it. So maybe yes. Avoids or is disinclined to begin homework or activities requiring concentration. Disinclined to begin homework? Every fucking teenager is disinclined to begin homework. Are you kidding me? But yes as a kid and yes now as an adult. Or activities requiring concentration. Yeah. Fails to focus on details and or makes thoughtless mistakes in schoolwork or assignments. As a kid, yes. Now, yes. Hyperactivity symptoms. Okay, those were the inattentive type diagnosis criteria. Now we're moving on to the hyperactive impulse type criteria. Squirms when seated or fidgets with feet and hands. Back then, yes. Now, yes. Marked restlessness that is difficult to control. Back then, yes. Now, no. Appears to be driven by a motor. What the fuck? And they've got a motor in inverted commas. Appears to be driven by a motor or is often on the go. Are these criteria actually, is that how that shit's written in the DSM-5? Yeah, it says it is appears to be driven by a motor. What the fuck do they mean by that? Don't we all appear to be driven by a motor? Or is always on the go? Back then, yes. Now, yes. Lacks ability to play and engage in leisure activities in a quiet manner. Back then, nah, now... No. No, neither of those apply to me. Incapable of staying seated in class. Back then, yes. Now, no. Overly talkative. It's a fucking monologue, guys. If you were on, you saw when I had my guest on, I didn't talk the whole time, right? I'm actually not. In a lot of social situations, you see, I take the back seat. I'm often not the one telling all the stories and stuff. I'm quite happy to be the listener. Impulsive symptoms, difficulty waiting turn. I would say no, but I fucking hate it. Like, I don't want to be in any queues. Don't put me in a queue for some shit. Interrupts or intrudes into conversations and activities of others. Back then, no, now, no. Impulsively blurts out answers before questions completed. Back then, yes, now, not so much. Additional requirements for the diagnosis. Got 3 cheeky little extras here. Symptoms present prior to age 12 years. All the ones I said yes to would have presented prior to age 12 years. Symptoms not better accounted for by a different psychiatric disorder. This is where I say my marijuana use, my drug addiction as a teenager may have better been the reason for a couple of those ones to do with attention. Symptoms are not excessively a manifestation of oppositional behavior. No, I definitely did not have oppositional behavior disorder. Combined type. Patient meets both inattentive and hyperactive for the past 6 months. Oh, okay, then there's 3 different classifications. The combined type, the predominantly inattentive type, and the predominantly hyperactive type. I would have definitely been the predominantly inattentive type, not the predominantly hyperactive type. But again, right, like, I mean, you know, clearly I would have met the criteria as a kid. And they say that ADHD, well, I've read it somewhere at some point in time that it does mellow out over time. So I don't know that I'd meet the criteria now. And look, for those of you who are out there considering this, like, holy shit, I've heard about friends who've got adult ADHD and, you know, they got prescribed some medication for it. There's a few different types, dexamphetamine, Ritalin, there's different ones, slow release, instant release, la la la. And they said their whole lives, they'd been given SSRIs for depression and anxiety, and it didn't help their depression or anxiety at all. And miraculously, they got diagnosed as having ADHD, and their ADHD medication totally healed their fucking depression and anxiety. I've fucking got anxiety and depression, and I might have ADHD. I'm going to get me a diagnosis, and I'm going to get me some fucking Ritalin, and that's going to solve all my problems too. I'm just saying, folks, just be wary. Just be wary, my friends, because it might be that a cheeky little Ritalin, might be that a cheeky little amphetamine puts a pep in your step that is, you know, positive, holistically, altruistically. It might be the case, but it might fucking not. I've known a whole bunch of people, especially in the last 2 years, who've got an adult diagnosis of ADHD and been medicated for it, and have not found the medication has solved their depression or their anxiety. It has certainly not solved or resolved any underlying trauma or other types of issues or you know, attachment traits and stuff like that could be problematic for them. There's some cases where an adult diagnosis of ADHD and the medication that they can get as a result of that is really helpful. I'm not denying that, but you know, the idea that it might be a silver bullet for you, you know, oh, if I get this fucking diagnosis and I get this medication, everything might get sorted out for me. Everything might be different. I don't blame anyone for wanting that. I don't blame anyone for wishing that. It's the same reason people take ayahuasca or mushrooms. You know what I mean? I'm going to go to this ceremony, you know. This is going to change everything for me. And look, things can help, right? A lot of things can help. I think it's more often that the things that help are the things that we have to work for, that require effort. An ayahuasca ceremony can be incredibly eye-opening. It can be profound. In fact, it almost certainly would be and will be. But it's not going to change your life. Like, I know a bunch of people who go to ayahuasca ceremony every month, right? And they think they're going to get these upgrades, these uploads. I'm just going to go and do but it's like, if you don't do the fucking work, you ain't going to get anything. At a certain point, the medicine will just start slapping your fucking ass, telling you, why are you coming back here if you're not doing the work in between times? It's not Amway, right? You're not going to get, it's not a pyramid scheme. You're not going to get better returns by taking more fucking ayahuasca. And I think, you know, the idea that there'll be some medication out there that's going to make us better, unfortunately, in a lot of cases, is kind of wishful thinking too. If we can do things that relax our nervous system, if we can do things that strengthen our ability to delay gratification, to tolerate distress, if we can do things like learn a meditation practice, like have cold showers, like do breath work, like do exercise or yoga, use our bodies, if we can remove foods from our diet that cause inflammation, and stimulation, if we can take things out of our media diet, out of that perpetuate anxiety and fear and distress, or perhaps just perpetuate fucking capitalist values and objectifying sexuality values, things that put us into a state of loss. If we can do all those things, we might be on a better track sometimes, to wellness, to health, to wholeness. And again, it's not a one-size-fits-all thing. I'm not in any way against medication. I'm not in any way against getting a diagnosis. Again, it can be really helpful. It's just this idea that, even forget about mental health. I've been doing it myself. Like I was like, I think I'm going to be a shaman. I think I'm going to be a witch. I don't want to be a fucking shaman. I'm going to be a witch. I'm a pain eater. I'm this special type of thing called a pain eater. I'm this thing called a sacred clown. I'm this thing called this. I'm this thing called that. That's part of the reason I thought I had borderline personality disorder, because the person telling me about it was like the sense of self stuff, and I was going, yeah, I always want to be this. I always want to be that. I hear about a Scorpio with a fucking Libra moon and an Aries rising, and I'm like, oh yeah, that's what I am. Or I hear about the sacred clown thing. I forget how to pronounce the name properly, and I don't want to say the wrong word. And I'm like, I'm that sacred clown character from the tribe, or I'm the pain eater, or I'm the this, or I'm the that. And it's like wanting desperately to be something, like some identity is gonna, and that's but I'm still fucking me, right? Like I'm not, even if I've got ADHD, I'm still just fucking Tommy. Like what fucking difference does it make if I'm a pain eater, or if I'm an ADHD, or if I'm a witch, or if I'm a fucking suit? You know what I mean? Like I'm me. I think there's some comfort, right? Like I'll be this thing now. Now I'll be on the spectrum. Now I'll be this, now I'll be that. Again, I'm not trying to in any way, now I'm demisexual, you know what I mean? Like I'm fucking non-binary. I'm a femme, I'm a cis male, but I'm femme, or like any way of it just makes, what it is? I think I'm seeking wholeness. I think a lot of us are seeking wholeness. I think a lot of us are seeking belonging. And it might be for some people that finding out, fuck, I'm non-binary, or I'm fucking ADHD, or I'm, borderline personality disorder, that gives them some sense of understanding, and it helps them with their wholeness and their belonging. I bet that happens. I bet that happens a lot. But I bet as many times as that happens, another thing happens, which is that we realize now we've got this new label, now we've got this new set of traits or criteria that help us make sense of how we experience reality. But it doesn't necessarily make us feel any more whole. It doesn't make us feel necessarily like there's any more belonging. I think a lot of wholeness and belonging comes from forming a relationship with ourselves. And if we're lucky enough to have pro-social peers or whānau in our lives, from putting the effort into making those relationships healthy and sustaining those relationships, which includes a shit ton of rupture and repair work. Relationships aren't just going to fucking be these beautiful vessels for wholeness. We are going to have to work at them. I think in this era where we can get a movie in 2 minutes that used to take fucking months and months of waiting for, maybe we don't want to do the work. Sometimes, we just want to take the fucking ayahuasca. Let the ayahuasca do the work. Let the diagnosis do the work. Let the medication do the work. I don't know that there's any shortcut that'll mean we can find that wholeness or that belonging without doing the work ourselves. And I know that's a heavy fucking thought for some of you. And I know that I know that thought has been heavy for me sometimes. So I apologize for fucking bringing y'all down. And I also, though I've probably said this so many fucking times, it would be ridiculous to say it one more time. I'm not in any way trying to discredit how significant medication, mental health support, licensed professionals who are credible and ethical, how incredibly helpful that is to so many people, and how integral, how essential a part of the journey that is for many people. I absolutely believe that. I don't think the Western medical system is amazing, but I don't think you want to throw the baby out with the bathwater. There are some conditions that the Western medical model has really good solutions for, or partial solutions for. And we should avail ourselves to all different methodologies for healing when we're trying to achieve healing. But for myself, let me just put it that way. For myself, I have found hard work. Consistent effort, energy, and concentration to be absolutely fucking essential. And I'm as close to wholeness and belonging as I've ever felt in my life. And it's been because of the effort I've made, not so much because of the shortcuts I've found. In saying that, I will continue to share every fucking shortcut I can with you folks, because I do believe that the ideal is that we can find this belonging and this wholeness with some efficiency and haste, because I know we fucking want it. I think we all deserve it. Yeah, I don't have a guitar. What am I gonna do? Do a freestyle? There's a fucking piano over there. You know I can't play piano. This will be funny though. Okay, I'll do a freestyle on piano. When I say I can't play piano, some people say they can't play piano, and they're like, and then all of a sudden they're playing chords and shit. I literally can't play piano, like at all. I don't know. I think the intervals are 2 semitones and 3 semitones would make a chord, but I don't know if that would be a minor chord or something else. Okay, this is a freestyle on piano. I'm going down. I'm going down to myself. Down to myself. I look around. I look around. And I'm going down. And I'm going down. The sustain's going for a long time. I don't know if you can hear that. I'm just waiting for it to stop before I stop. It was alright, hey? Just 3 keys. That's all you need to make a song. Hey, have a beautiful day, folks.